Hey, I'm Dr. McCluskey. We're going to do a little Q&A. I often get asked how much fat is needed for a Brazilian butt lift. It's a tough question because everyone's different, but a lot of patients are simply too thin. If I have a thin girl, the first question is, how do we perform a butt lift? The simplest method is to contour the outer thighs, posterior thighs, and the waist and hips. And this alone, by narrowing the waist and hips, narrowing the posterior thighs and outer thighs, provides a much nicer contour to the buttocks. From the side, we'll also contour the abdomen, especially the lower abdomen, where women tend to store fat, and the lower back. Again, posterior thigh. So after performing this liposuction, we're able to take the fat, and it's even in a thin patient, I can still potentially get enough to perform a moderate butt lift or fat transfer. So the fat, after liposuction, is stored in a canister such as this. In a fat transfer procedure or Brazilian butt lift, we use a sterile canister. This canister will hold 2,000 cc's of fat. For example, in the case I did yesterday, I got 1,200 cc's of purified fat. The rest was fluid. But 1,200 cc's of purified fat divided in two means we can put 600 cc's per side. So we take the 600 cc's of fat, and we'll just go ahead and write that on there, 600 per side. I can inject it through very small incisions, and I put them in convenient little hiding spots so they're not obvious, not visible, whether you're wearing a swimsuit or going without. So once we inject it, we'll have a much more obvious contour to the buttock. It's especially visible in profile. And again, these little incision sites are hidden within the creases. So in a large volume fat transfer or Brazilian butt lift procedure, I may get 2, 3, even 4 liters of purified fat to the point where I can put over 1,000 cc's in each side. As you can imagine, this is a much more drastic and dramatic result. But even in the example we're talking about, in a thin patient, where we're just contouring thighs and hips, lower back area, and the posterior thighs, we're typically able to get enough fat to really augment the buttocks, lift them. So because the Brazilian butt lift or fat transfer uses your own fat, it's really an operation designed for people of all shapes and sizes. You can check our other videos and photos to see real examples of this operation and the before and after results. That's about it. Thank you.